Hi, I'm Jim Brexler, President and CEO of Doylestown Health and Doylestown Hospital. And I want to spend just a couple of minutes with you today, sharing with you some of the ways that we're all having to operate differently during these extraordinary times. Instead of an immediate entrance, you end up with a stop sign. We're not telling you to stop getting your care. We are open completely for business, but we are being very careful in rationing those limited resources and our beds to be prepared for the surge that may come. So only emergency and urgent care that physicians feel are needed today are being performed. I've asked Ron Strouse, Mayor of Doylestown Borough, and Stephanie Mason, Manager of Doylestown Township, to share with me today some of the things that are going on in the borough and the township and how Doylestown Health is working together with you. Mr. Mayor, so tell me about how different Doylestown Borough is today.
Well, I have to have a smile about that because so much is different from where we were just 2 weeks ago. There's no denying that in many ways the quality of our lives has changed and diminished, recognizing the importance of responding in responsible ways. We've been fortunate that compliance, voluntary compliance has been extraordinary in the community and beyond the community. I would think at this point in time, we're really talking about encouraging those people who may need help, knowing how they should comply, knowing how they should act in a responsible way going forward. That's where our attention needs to be at this point in time, from my perspective.
So Stephanie, one of the key themes today is that we're wanting to make sure that our community understands they need to stay in to protect themselves and to protect others. But what in the community is still available to us to take advantage of?
Jim, what people can do is to get out, get fresh air, utilize the trail system. We have over 30 miles of trails in Doylestown Township. It connects you to Doylestown Borough and the surrounding communities. It's quite extensive. Get your bicycle out at springtime, walk with your family, take your dog for a walk, be on the trails, just be careful and keep your social distance. Can you explain to the community how Doylestown Health prepared for this COVID-19 pandemic we're experiencing?
One of the things that we're doing is adding as much capacity and preserving critical resources that we think may be necessary if there's a surge. So we've got additional beds now available because of the change in priority of only urgent and emergent care being done. We brought in a MASH tent that allows us to see patients just outside of the emergency department without them having to come in and tie up the emergency department resources. Private physicians are seeing patients in one part of the tent that have respiratory issues, and emergency department will be seeing and holding patients while we monitor to see if there's even a reason for them to be hospitalized at all.
Jim, the community wants to know how they can be involved in helping. And I know you have a website that would help them out with that, and it's doylestownhealthfoundation.org, but perhaps you can highlight what they would see when they go to that website.
Well, Ron, that is a wonderful question. At the Doylestown Health Foundation website, what you'll see is we've listed our priority needs and the process by which people from the community can let us know they have something to give and the process by which we can receive it. Two of the most critical items, though, that I want to highlight are masks. Masks are really important, and it's what we have the most shortage of. This is the N95 mask that you hear talked about in the news. This is what we use if a patient has an infectious disease. And this is a surgical mask that all of our staff are wearing to prevent any cross-contamination from one staff member to another or from us to the community and vice versa.
So I think the most important message going forward is we each have a part of that message, but in my part, it's that our community and everyone who lives here needs to stay calm.
My part of the message is please stay home.
And our most important message to everyone is stay safe. We're here to keep you safe. We need you to be our heroes, just like you said, we're your heroes. We need you to be our heroes by staying home and keeping us all safe.